tinnitus. What is tinnitus?
Tinnitus, or sometimes called tinnitus, depending on your pronunciation, is actually ringing in the ear, and it can come in various forms. Some people have high-pitched ringing. Some people have a sound of bells or crickets, and it's variable. It can be on one side, it can be on the other side, it can be on both sides, and it can be constant or intermittent. Some people have pulsatile tinnitus, which is actually a ringing or a sound which occurs at a pulsation.
Is there any treatment for it?
Tinnitus, depending on we first like to determine if there's something bad that's causing tinnitus, and especially if it's on one side or if it's pulsating, it raises our suspicion a little bit more. Depending on the exact presentation, it sometimes warrants an audiogram, hearing test, and it can sometimes warrant, depending on what that shows, an MRI scan or other imaging. There are certain types of tinnitus which are concerning and can be a sign of things like benign tumors.
Can diabetes be a trigger?
There are hypertension oftentimes can cause it. Diabetes is less commonly cause of it. Some of the medications that are used to treat common illnesses can cause tinnitus.
Any particular ones you can think of here?
The most common ones are the NSAIDs, or the non-steroidal anti-inflammatory medications, Motrin, ibuprofen, Advil, those types of things. The other ones are simple things like Sudafed, which are oftentimes used for sinuses or congestion. And caffeine intake has been highly correlated with increasing the amount of tinnitus and ringing.
Can also be with age. You can hear.
You can. There are as your hearing decreases, sometimes tinnitus will occur. The current theories think that tinnitus is caused by a lack of auditory input to the ear, and by that fact, your body is creating a sound which it perceives. It's a poorly understood phenomenon.
Is there any treatment for it?
There are certain treatments, depending on how bad. There are none of them are 100% effective. However, there are certain vitamin and medication supplements which have been shown to help with tinnitus in some patients. There are feedback techniques which have been shown to help in tinnitus, and sometimes, if it's very bad, hearing aids will actually help with tinnitus.
Certain background music help sometimes?
Those are some of the modifying factors, exactly. Placing background music on, or white noise, sometimes a box fan in the room when you sleep, will help drown out the tinnitus. And essentially what it's doing, it's placing auditory input to the ear, and we think that helps remove the sound that you hear.
If you were listening to a lot of loud music and you got somewhat of a hearing loss, would that also come afterwards though? It
can. That's oftentimes referred to as a temporary threshold shift, and that is a decrease in the hearing, and also oftentimes associated with ringing due to a loud sound that affects the outer hair cells of the cochlea, or the hearing organ.